I got this weight on my shoulders, slowing me down. I don't know how it came about, and why the world is spinning faster.
All right, we're gonna try it like this because it's really dark out there. Good morning, everyone. Welcome back to the channel. My name is Gianluca, aka Dr. Calcagno, and it is a super early morning. We brewed the coffee twice as strong this morning, which means only one thing, and that is we are heading into the emergency department. I am currently on my emergency medicine rotation, and we're doing an 8-hour today, early morning, and I have no idea what's waiting for us. Now, for those of you that just stumbled across this video, I am a first-year family medicine resident working and studying here in Canada. I am currently in my third week of emerge for this rotation as a family medicine resident. So we do 3 months of emerge, and emerge is definitely something that I'm interested in to do in some capacity when I'm done my training. So I've been enjoying it so far. We've seen everything from trauma to different illnesses, COVID, just everything going on right now. It's really busy in there. And I think in a certain aspect, that's probably one of the best parts about working emerge from a novelty standpoint, especially when you're new and you haven't been doing it for long. But we'll see you guys in a little bit, and we'll see what today has in store for us. So, quick guide to working emerge 101. It's just a fast-paced lifestyle. I'm here on lunch right now. Get a 20-minute break, basically. Shifts are about 8 or 12 hours, depending on your shift. And it is rammed in there right now. Depending on the patient complaint and the level of acuity, you could expect to wait anywhere from 2 hours to 4 hours. I think 4 is our average right now, actually, for mild acuity, to maybe even longer sometimes. And everyone's working full capacity. You're bouncing around as quickly as you can. So these lunch breaks need to be super quick. I'm gonna run down right now, grab myself another coffee at Tim Hortons, and then power through. We got like 3 hours left. And that's basically how you do it. Get in there, you work really hard, come take a quick break, refresh, more coffee, head back out there. So one thing that I'm really intent on doing with these vlogs is showing people exactly what it's like to be a resident physician here in my spot. And that's why we got these for you right now. These are my evaluation sheets. And basically, as a resident, you are still going to be evaluated by preceptors, doctors that have been working for a while that you're working with when you're on shift. And in the emerge, what they look like for me anyways is they're paper evals. As you go out throughout your day, you're going to be recording the patients that you actually took primary ownership of while you were in the emerge. And just for people to know, I saw 12 patients over an 8-hour shift today. That's not anywhere near as much as a seasoned emergency medicine doctor, but I am relatively new, I would say, to the scene. I think it's totally reasonable to say that a well-seasoned emergency medicine doctor could probably see 30 to 40 patients if they were really working hard and the patient complaints were of the variety where you can move through them really quickly. So 12, I was pretty happy with that. The ones that I had today, if you guys want to know what I saw, I'm gonna remove all the patient details so we can't identify anyone here, but bloody diarrhea, threatened abortion, then a second threatened abortion after that, a viral upper respiratory tract infection, low back pain, gastroparesis, costochondritis, viral myositis, standard abdominal pain, laceration from self-harm, left-sided foot injury crushed on a construction site, and one resuscitation that I don't want to talk about right now because it is still pretty fresh, and I want to be as respectful for the person as possible. So from a gym standpoint, everything's been going really well lately. I had a few people ask me about goals and things that I'm working towards. We recently did the Tough Mudder race, which was a 15-kilometer obstacle course race, and we had a really good time. It was awesome. And after that, I was just looking back on some pictures, and I've been training at the gym pretty consistently now. From 26
about 12 or 13 years right now. And I think I'm really happy with the way my physique has come along since then. But I don't want to get complacent. I think that's a big part of everything, not just the gym, but school and whatever else you're involved in. So I always keep setting new goals for myself. So right now, I'm trying to hit 4 plates on a deadlift, a plate and a 25 on my standing military press, 2 plates and a 25 on my bench press, and working slowly towards a 3-plate squat. Those are my big goals for the next year, by this time next year. And I don't know if we could hit them, to be honest with you, but I feel like my training has been going really well. Depending on how we look at it, I got a 3rd or maybe 4th job now. One of the two. I got another job. And thankfully this one pays a lot better than being a resident. But basically, today's Wednesday. And on Wednesdays, I start off in the family clinic at 9 o'clock in the morning. And then I do that till about 12 o'clock. And then at 12 o'clock, we do, you gotta come to school. Lecture start at 12:30. We'll do 12:30 to about 5 o'clock. And then I start up again at 6 teaching with the medical school. So that's my new job. And I've been doing it basically every single Wednesday. Probably gonna be doing it for the rest of the year. And then we'll take it from there. So I've really been enjoying the teaching part of it so far because I taught standard first aid a while back, and I remember being in medical school, being a student, and wanting to actually get involved with teaching later on. And now that I'm here in residency, there's like a lot of different opportunities for you to get involved. But clinical skills is my favorite. Today we're going to be doing the cardiac exam. In the first semester of medical school, the med students do the cardiac exam and the respiratory exam and a few others. So that's what I've been tasked with today. And this is a total recreation of a clinical setting. There's everything from the exam bed to the different instruments that you'll see. We practice taking blood pressure, doing vitals and things like that for the first year medical students. But the coolest part is actually this 2-way mirror right here, which is really interesting. You can see right through to the other side. And then what we get to do as examiners and instructors is we could hire SPs or standardized patients to come in, recreate certain conditions or diseases that we want to test the students for, and observe them through this mirror, which is actually really, really cool. Alright everyone, that's going to be it for today's video, for the vlog anyways, for the most part, because I still like to do some wrap up at the end, go over some totals for amount of hours I'm going to be working in a week and what I did. Basically, yesterday was the emerge shift, today was family medicine and teaching, and now doing a whole bunch of U-roll questions probably for the next 2 to 3 hours. I have my USMLE Step 2 exam, the second time I'm writing it now, coming up on December 13th, so it really is just trying to do 2 to 3 hours of prep for that per night. And about 2,000 questions left of U-roll that I'm trying to burn through right now. Now, if you have questions about the USMLE exams and why I'm writing them and stuff like that, I did a whole bunch of videos on them before. I'm not going to go into it now because I don't want to make this video too long. But I will say that trying to study for a really long exam is really hard right now in residency, because you work during the day, you come home, you study on the notes and things that you learned during the day, and then you have to do additional studying after that. It's pretty rough. It's pretty rough. So from the top, all the different things that I'll do in a week is family medicine shifts, still on the days that I'm not in the emergency department. Then it's about 2 to 3 emergency shifts per week. Then once every 2 weeks, I'm in a long-term care / nursing home for members that are a little bit older and have different medical conditions there. So I stop off, spend the first 3-4 hours of my day there before I go to family medicine afterwards. Then I'm doing my teaching position. That probably takes about 4 to 5 hours of my time per week by the time I make my lesson plans and then go in and actually give the lesson that I'm supposed to do. Then I have YouTube, and then I have studying for this exam. So I don't really know hours wise. It feels like there's a lot going on right now, and I think that comparing me right now to this exact same time last year, I can't even. It's on a totally different level in terms of just so much going on. Now, here's the thing. I do want to leave this video off on a positive note. One of the questions that I get asked by a lot of students, is probably my most frequent question right now, is being in residency, what were the changes that you made? How do you get to a particular spot where you're able to do all these different things and stay on top of everything and all of your responsibilities? And I tell everyone the exact same thing, and that I really do believe that there is absolutely nothing special about me at all. There's no inherent quality that I have that makes me able to do anything in particular. The thing that keeps me able and in the game and to be able to do this stuff is that I absolutely refuse to give up. And I think that is the advice that I want to share with people today. I set my goals. I knew that I wanted to do teaching. I knew that I want to keep doing YouTube, and I'm going to keep doing YouTube. Just editing these videos takes forever. But if I have to give up sleep to study for this exam coming up, if I have to not go out on weekends because I have to do other things for different responsibilities that I have with my job right now, that is currently my mentality, my mindset. I am going to work so hard, and I continue to work so hard and try my best in everything that I do, especially when it comes to my job, especially when it comes to being in the hospital. One of the things that I know though, especially going through it right now, is that my best isn't enough. It's not enough for the things that I'm doing. If it was enough, then all I would have to do is go into work and just try my best and everything would work out all the time. But that's not the way residency works. You become very aware that you could try as hard as you want, but your best really just doesn't cut it. The only way that you get to learn is to keep pushing yourself, to keep holding yourself accountable and putting in work to notice this very small incremental progress that you make. And you do see the benefits over time, but you guys just have to keep going. You have to put your head down. You have to do the work. You have to give things up to know that you will come out better on the other side. You have to believe in yourself before you actually see the progress. And I feel like that's a good way to describe what residency has been like for me recently. I feel like I really am just trying my best for everything. And there's some days where the shift goes amazing and I excelled and my evals are stellar, almost perfect in some cases. And there's some where it doesn't matter what I do, but it just feels like everything's wrong. And certain things come a lot more difficult than others, but it all comes back to this at the end of the day, trying to regroup, to reset, to work a little bit harder so that it does pay off the next time. And that's what I would tell everyone that's going through it right now, because I know a lot of you are going through it. It's not just me. We're all going through our own thing right now. So I want to wish everyone the best of luck. Thank you so much for stopping off today. We got more videos that have already been filmed, interviews, they're coming out, other stuff too. And we'll see you all in the next one. So everyone take care.